All right, we have one more bill. Representative Bonner. House File 1197. Rep. Bonner moves that House File 1197 be laid over for possible inclusion in an omnibus. There is an author's amendment. Bonner moves adoption of the A5 to put the bill in the form. The author intends to discuss it. All in favor? Aye. Aye. All opposed? The motion prevails and the amendment is adopted. All right, to the bill as amended, Rep. Bonner. It is in the shape you prefer, and please introduce yourself and welcome to the committee.
Thank you, Mr. Chair and members, for indulging as well. Too many hearings, too little time, right? But Mr. Chair and members, House File 1197 has been worked on since 2022. It is a priority this year as some of the permissions granted to pharmacists and pharmacy technicians since 2020 that have been instrumental in delivering care during the pandemic are set to expire at the end of this year. The bill before you is simple and straightforward. It ensures that fully credentialed, trained pharmacists, supervised pharmacy technicians, and pharmacist interns who are an essential part of the care continuum may continue to perform basic immunizations and testing services in the pharmacy setting, as they have throughout the pandemic and are currently providing for Minnesota patients and families. With the addition of the amendments, the bill incorporates the changes adopted by the Senate HHS in late February, which includes a consensus position regarding the age at which vaccinations can be administered in a Minnesota pharmacy. It incorporates additional training requirements for pharmacy technicians and pharmacist interns and clarifies their supervision by a licensed pharmacist. And it maintains the positions of the current Minnesota pharmacy immunizations and CLIA-waived non-lab tests, provisions in the Practices Act, Minnesota 151.01, Subdivision 27. Overall, the bill continues the current practice of vaccinations for COVID and flu, as well as all ACIP recommendations and FDA-approved immunizations, basic maintenance medications such as Vivitrol for treatment of alcohol or opioid use disorder, and they provide essential services like non-lab health testing and other medication managements. Services for patients. While doctors and clinicians continue to make the case, they cannot do this work alone. With concerns we are falling behind overall on vaccinations, they continue to agree the service pharmacies provide are much appreciated to fill in the gaps. I'm here today to enlist your support for the continuation of an incredible story. During the pandemic, Minnesota pharmacists, pharmacy technicians, and pharmacy interns were able to vaccinate and test millions of Minnesotans. In 2020, federal authorities turned to pharmacists and pharmacy techs to get the job done, and they delivered. With most areas of the state within 5 miles of a pharmacy and in areas of greater Minnesota a bit further out, where access to these services is often your trusted local pharmacists, they delivered in a big way. This is why over 56% of Minnesotans currently receive their vaccinations in a pharmacy setting. With federal authority set to expire on December 31st of this year, we need to act to ensure that Minnesotans get access to the care they need by joining the 30 plus states that have already codified the ability of pharmacists and pharmacy techs to continue this important work. With that, members, I also have here in your packet letters of support from the Minnesota APRN coalitions and MNNP, as well as examples from physicians and various supporters. I will add here today that unfortunately Dr. Jonathan Ken Knight, the pediatrician at Essentia Health of Duluth, sends his regrets. He had hoped to be here in person, but we were not able to do electronic testimony for today, so my apologies there. But we do have 2 other wonderful testifiers to speak to the bill. And with that, I will turn it over.
Thank you, Representative Bonner. And first up is Professor Philbrick. Please introduce yourself and proceed.
Thank you, Chair and members of the committee. My name is Ann Philbrick, and I am a doctor of pharmacy and associate professor at the University of Minnesota College of Pharmacy and Medical School. Thank you for allowing me to testify today. I've been a pharmacist for 18 years, and I've been in charge of immunization training at the College of Pharmacy for 14 years. I have trained and taught hundreds of pharmacists, pharmacy technicians, and pharmacy interns across Minnesota in both in-class content, in the pharmacy curriculum, and through separate American College of Pharmaceutical Education, or ACPE, accredited continuing education courses. Through my position at the University of Minnesota, I have seen the great work that our pharmacy workforce has been doing in community pharmacies, clinics, and health systems. Minnesota's highly trained pharmacy workforce is doing an amazing job with over 5 million vaccinations administered in a community pharmacy setting since 2020. Immunization delivery has been integrated into the PharmD curriculum since 2002, when pharmacists were first given authority to administer vaccines in Minnesota. Pharmacy interns, or students, receive approximately 20 hours on vaccine-preventable diseases, their corresponding vaccines, and vaccine schedules. They get information on precautions, contraindications, and side effects of these vaccines. They are also trained in responding to vaccine-related emergencies, such as fainting or anaphylactic reactions. They also have the opportunity to apply this knowledge through cases and make vaccine recommendations. Finally, and most importantly, they get hands-on experience with administering both intramuscular and subcutaneous vaccines at least 3 times in a laboratory setting, as well as have ample opportunities to apply this knowledge and skill on introductory and advanced pharmacy practice experiences. A corresponding ACPE accredited continuing education course is available for practicing pharmacists. In 2021, I developed a 5-credit ACPE accredited continuing education course for pharmacy technicians. As the HHS PrEP Act and this proposed legislation makes it clear that pharmacists are the ones to make actual recommendations, this course does not focus on who should receive certain vaccines, but rather focuses on general information about these vaccines, including potential adverse effects to share with the patient, as well as storage and handling. The course also includes information on responding to vaccine and related emergencies. And finally, the course culminates in being able to correctly demonstrate both an intramuscular and subcutaneous vaccine. Hundreds of pharmacy technicians have taken this course to date. I urge you to pass this legislation so that Minnesota does not go backwards in the great progress that we've done in the past couple of years. Please support this bill. Thank you.
Thank you. Thank you, Dr. Philbrick. Next up, Mr. Jason Miller. Welcome. Please introduce yourself to the committee.
Good morning, Chair and Committee. My name is Jason Miller. I'm a pharmacist with Coburn's and Cashwise Pharmacies. I'm here on behalf of Minnesota Pharmacists Association and the Minnesota Pharmacy Alliance in support of this bill. This legislation, as stated previously, would authorize pharmacists, trained pharmacy technicians, and interns to continue the immunization and testing services they have been providing to patients across Minnesota since 2020. And as a reminder, to highlight the urgency of this bill, the federal authorities that we're currently working under today will expire at the end of the year, and patients will then not be able to obtain certain services they have come to expect in our local community pharmacies. Stakeholders from across Minnesota's health systems, the Board of Pharmacy, and Department of Health have worked together and come to agreement on this amended language for House File 1197 to keep those authorities in place. It was almost 4 years ago now that the PrEP authorities authorized pharmacy technicians that have completed training and have become certified to administer immunizations. Pharmacy technicians stepped up, as mentioned. They provided critical access to care to respond to this pandemic. This bill language specifies the training, credentialing, and supervision requirements necessary for them to participate and ensure the continued safe provision of patient care for Minnesota residents. And moving forward, speaking for all of pharmacy, we simply cannot continue to provide that elevated level of care without the authorization for pharmacy technicians to vaccinate. These provisions also include the pharmacist's ordering of immunizations and some CLIA waive tests independently. This will allow us to better support our current healthcare system that is stretched thin and struggling to meet the demands of an aging population. It also allows for pharmacy to continue to provide immunizations to patients at a slightly expanded age range. The compromise language in this bill allows for vaccinations for flu and COVID to ages 3 and up, and 6 and up for all other vaccinations. And this will actually catch our state up to about 30 other states that have authorized pharmacy to vaccinate patients 6 years and up for ACIP recommended and FDA approved vaccinations. So on behalf of all Minnesota Pharmacy, we ask you to please support House File 1197 as amended so that my colleagues and I can continue to provide the services you and all Minnesotans need.
Thank you very much, Mr. Miller, for your testimony. I don't see any other listed testifiers. Is there anyone from the public that would like to speak on this bill? Seeing none, we'll move to member questions. And Representative Nadeau.
Thank you, Mr. Chair. Thank you, Representative Bonner. Can you, online, I'm curious, well, I have two questions. I'm going to start with this one. Starting at line 4.31, where we're basically saying that MA is going to cover this cost provided at the pharmacies. Do we need special CMS authorization to do that, or is that already an approved repayment for our public health programs?
I may need to phone a friend on that.
Bonner, we'll have Mr. Miller will come forward. Or we have Mr. Hope coming down.
He's interested in doing it.
Thank you. Please introduce yourself for the committee. Appreciate it.
Good morning. My name is Chad Hope. I'm the Director of Pharmacy at DHS. We do have to do state plan amendments when we add new coverage and services. These are already covered services. I do not know if we have to do a state plan amendment to add pharmacists as independent prescribers. They are currently acting in that role with the PrEP Act Authority. We may have to do a state plan amendment, but that would not be overly onerous to do that.
Thank you, Mr. Hope. Mr. Representative Nadeau.
Yeah, thank you, Mr. Chair, and thank you for that. Just a quick follow-up on that. How long does that take? I know you said it's not onerous. How long does that take?
Mr. Hope.
Mr. Chair, Representative, the state plan amendment process really is variable. For something like this, I would not anticipate it would take very long. Generally, CMS will approve those sorts of updates. We're talking weeks to months, not years.
Okay.
Thank you, Mr. Hope.
Thank you.
Good questions, Mr. Representative Nadeau. Do you have more?
I just have one more, just because I don't understand the difference between a technician and an intern. Can someone tell me the different scope of work or how that works?
Dr. Philbrook.
Chair, Representative, a pharmacy intern gets that status after 1 year being in the PharmD program at any college, but at the University of Minnesota in Minnesota. A pharmacy technician has either done specific training, a certificate program, or they have done on-the-job training. So it just is a difference of being in a doctorate of pharmacy program versus kind of on-the-job training.
Thank you, Dr. Philbrook. Any further questions? I do not see any. We will go to final comments. Representative Bonner.
Thank you, Mr. Chair and members. It's a good bill. It allows folks across the state to continue to serve critical access or take care of the critical needs of Minnesota families and patients. And we know from talking to clinicians, and I've talked to many, that they have said we are falling behind on our vaccinations for adults and children. And so any ability to access that continuum of care to really get the job done is much appreciated, and the clinicians have said so flat out. So we would really appreciate your help in making sure that they can continue to deliver those services. Thanks so much.
Thank you, Representative Bonner, for the bill. House File 1197, as amended, is laid over.